So psoriasis is an inflammatory skin disorder. It starts internally with an overactive immune system that manifests as these silvery, scaly plaques that can happen anywhere on the body, the scalp, the elbows, the knees, the folded areas. It can be itchy, it can be uncomfortable. And a lot of times when my patients come in, they really talk about the way that other patients perceive them, how it looks, how the scale will fall on the floor, and how they're worried that sometimes patients may think that their rash is contagious. So there are topical treatments, oral treatments, and biologic treatments. And one of those treatments that I've had good success with is a medication called Ilumia that allows for 4 in-office injections a year. And those in-office injections really allow me to communicate well with my patients, watch as they do better, and really make sure that we know that this is the right treatment option for them, really working together with the patient as a team to make sure that we're on the same path going forward.
Well, my journey started at the age of 7, so I was pretty young. I'm now a senior citizen, and so I've had psoriasis for many, many years. Back in 1962, when I first got psoriasis, pretty much the treatment du jour was to use steroids. And so that's mostly what I had to my disposal back then. There, later, I had some light therapy along the way, and you fast forward enough time and enough years, going back about 25 years now, when the first biologic came out, and those have just been an absolute godsend. Dr. Noor had mentioned Illumia. I'm on that also. And that's one of those medications where you can go from somebody that's been covered 90, 95% in psoriasis, and within a matter of 2, 3, 4 months, have no psoriasis, and the results vary depending, on each individual case. But wonderful innovations nowadays.
So it's important to realize every person is different. Long gone are the days where, patients would come into the office, physicians would tell them what to do, and everyone would do whatever their doctor told them without Googling anything, checking anything, without even communicating. Now we know, and maybe because we do have a lot of treatment options for patients, we have to communicate well, and we have to learn about each individual story. You hear Mark's story. It's a story of one, and we want to make sure that we find the right treatment for you. So when patients have plaque psoriasis, it's important to find a dermatologist and communicate well. And, Mark says it best. Don't take no for an answer. Find the right option for you. If you don't feel that you're getting the right option for you as the individual, get a second opinion. Find the right person to work with, the right physician, and eventually you'll find the right option. Yeah, so plaque psoriasis is a full spectrum. You can have all the way from mild to severe, where our patients with more moderate psoriasis, it can affect the scalp, it can affect the elbows and knees. But like Mark said, he had 95% of his body covered in plaque psoriasis. And with the newer technology, with the newer advances and treatments, we can see how great Mark looks now. We can feel comfortable that we have treatment options that span the spectrum for patients with even 95% of their body covered. We can have treatment options for you.
Don't give up, and know based on comments like my own that there is hope for you. You don't have to just throw your hands up in the air. Somebody struggling could see a good dermatologist like Dr. Noor today, and you could be on some kind of a plan when you leave his office. And you could be rid of your psoriasis or have it under really, really good control and management in a matter of a few months. So be relentless in your pursuit of getting yourself better.
So for more information, go to illumia.com/I love ya. That's ILUVYA.